Is there any such thing as free healthcare in Nigeria?
Well, in some places we pretend to be doing that, but it's just all pretense, maybe for political reasons. Free healthcare, if and where you have, you know that the quality will be compromised, which is almost the same thing as it not being available. Because most of the governmental institutions or healthcare, there are situations where you have about 1,000 people going for antenatal in one location, and some of them get there as early as 2 a.m. and they don't leave there until say 5 p.m. That is enough discouragement to the women. Why? Because it is free. And you have situations where they just pass through the system, and a lot of things are missed in the process. Mm-hmm. So if you talk of free antenatal or free healthcare services, well, it's desirable, but it has to be qualitative also.
And do you think this is achievable? Do you think the government can actually provide quality free healthcare like the Western world does, like the other developed countries do for Nigerians?
Well, it is possible, but it will also be very difficult.
Why?
Because the resources we have will not be able to go round. And then our priorities also, we need to reorder our priorities. For instance, an institution makes a budget and buys MRI machine, CT scan machine. That same institution does not have a blood pressure measuring apparatus. One is like 5,000, 7,000 naira. The other one is in millions. And then they take pride in say we have such machines. Mm-hmm. Another institution will say they are doing renal transplant, but they don't have drugs to prevent malaria or treat malaria. So those are the things we need to sit down, reorganize, and see whether we can. There is need for a lot of reorganization in the health sector. Now, if you say free this, free that, the personnel you have there, their attitude equally matters a lot. Mm-hmm. If you say everything is free and at the end of the day there is no drug, the equipment to work with are not there, you leave room for a lot of things to go wrong. And that, unfortunately, that is what we have in centers that say they are operating free healthcare, such that sometimes you want to do examination, you cannot get gloves. The patient will need to go and buy gloves. The patient will need to go and buy sutures. That is the state we are.
Wow.